Gum disease affects nearly 90% of adults globally, yet most remain unaware. Often painless in early stages, it begins with plaque buildup at the gum line. Studies show 50% of bleeding gums are ignored, allowing bacteria to erode jawbone over time. This silent epidemic is the leading cause of tooth loss worldwide, surpassing cavities. Modern dentistry reveals it's entirely preventable with proper care. Plaque, a sticky biofilm of 700+ bacterial species, triggers gum inflammation within 24 hours of inadequate cleaning. When left for 72 hours, it hardens into tartar that harbors pathogens like Porphyromonas gingivalis. These bacteria secrete toxins, destroying gum attachment to teeth. Research confirms tartar can't be removed by brushing alone, requiring professional intervention. Bleeding during brushing, the most ignored symptom, indicates active inflammation. Persistent bad breath, halitosis, often stems from bacterial volatile sulfur compounds. Gum recession exposes sensitive roots, while pus pockets signal advanced infection. A 2023 Journal of Periodontology study found 78% of patients dismissed these signs for over 6 months before seeking help. Chronic gum inflammation doubles heart disease risk by spreading bacteria through bloodstream. It worsens diabetes control by increasing insulin resistance. Pregnant women with periodontitis have 3x higher preterm birth risk. Alzheimer's research now links gum bacteria to amyloid plaque formation. The American Dental Association confirms treating gum disease lowers systemic inflammation markers by 40%. While laser therapy, 1,500+, and gum grafts, 3,000+, exist, the Journal of Clinical Periodontology confirms early-stage reversal requires only proper cleaning. Even advanced cases improve with consistent home care. A 5-year study showed patients using correct brushing techniques avoided 87% of recommended surgeries. Insurance data reveals 60% of deep cleanings, scaling, could be prevented with daily interdental cleaning. Modified base technique, angled 45 degrees at gum line with gentle circles, removes 260% more plaque than horizontal scrubbing. Use ultrasoft bristles, 0.15 mm diameter, to avoid gum trauma. Electric toothbrushes with pressure sensors reduce overbrushing damage. Research confirms 2-minute brushing removes only 40% of plaque, adding interdental tools reaches 85%. Always brush before breakfast to protect enamel overnight. Saltwater rinses, 1/2 teaspoon sea salt in warm water, reduce inflammation by osmosis. Coconut oil pulling decreases Streptococcus mutans by 60%, Journal of Traditional Medicine. Aloe vera gel applied to gums reduces bleeding scores by 30% in 8 weeks. Green tea catechins inhibit collagen-destroying enzymes. Note, these complement but don't replace mechanical cleaning. Bacteria must be physically disrupted. Vitamin C, kiwi, bell peppers rebuilds gum collagen. Deficiency causes scurvy-like bleeding. Omega-3s, fatty fish, lower gum inflammation markers by 20. Probiotics, kefir, kimchi, suppress pathogenic bacteria growth. Avoid acidic drinks, pH 5.5, that erode enamel. A 6-month Nutrition Journal study showed participants eating 5+ daily servings of crunchy vegetables had 42% less gum recession. Morning, oil pull while showering, then brush with aloe vera toothpaste. Post-meals, rinse with salt water. Use interdental brushes. Night, 2-minute Bass method brushing. Apply vitamin E oil to gums. Weekly, massage gums with warm chamomile tea bag. Track progress with gum selfies. Improvements appear in 3 to 7 days. Studies show this routine reverses gingivitis in 94% of cases within 21 days. Consistency is key. Gums fully regenerate every 4 to 6 days when properly maintained. Annual dental visits detect subclinical issues. Patients maintaining these habits preserve 3.2 more teeth by age 60 versus national averages. Remember, pink, stippled gums shouldn't bleed when touched. Share this knowledge. Help break the cycle where 1 in 2 adults lose teeth to preventable disease.